today's topic is going to be about intestinal malrotation. So this is quite a easy to understand topic, so it's going to be a very short video. So intestinal malrotation, we're going to start in this corner. There are three things that are important to remember in intestinal malrotation, and that is: number one, there is bilious vomiting; two, there is abdominal pain; and thirdly, the stomach is emptying into the right lower quadrant instead of across the ligament of Treitz. So what is the pathology of malrotation? First of all, we want to mention that intestinal malrotation is a surgical emergency. There is a volvulus of the intestines, and 50% of cases would present within the first month of life. So very early presentation, and 90% of all cases of intestinal malrotation would have presented within the first year of life. So this is quite difficult to miss. Okay, over here you can kind of see I have attempted to draw intestines that have been twisted into a volvulus. Okay, so the most common form of intestinal malrotation is when the cecum remains high and fixed through the posterior abdominal wall, and there is Ladd's bands which obstruct the duodenum. So over here you can see this is the lower esophagus emptying into the stomach, and then the duodenum, intestines, and so on. Over here is the cecum. So the cecum, the normal position of the cecum, is supposed to be somewhere around here, okay, in the lower right quadrant, whereas the abnormal position is high up here, and it is being fixed in this position to the posterior abdominal wall by these bands. So these fibrous bands are also known as Ladd's bands, and as you can see, as they are fixing the cecum to the posterior abdominal wall, these Ladd's bands are compressing the second part of the duodenum and thereby causing obstruction at the outlet between the duodenum and the rest of the intestines. Okay, so on clinical presentation, what you would usually see is that there is acute, forceful bilious emesis, which is an important point. It's bilious, meaning that it is bile containing, so it would look a little bit green with a green tinge on appearance. So the reason why it is forceful is because there's an obstruction. It's bilious because, as you can see, the obstruction is distal to the duodenum. So it is distal to where the bile enters into the duodenum. So important to note is also, if you have any patient below the age of 1 and they have bilious vomiting, it is malrotation until proven otherwise. Okay, there is small bowel obstruction, so you will have the signs and symptoms that accompany small bowel obstruction. For example, your abdominal distension. Bloody diarrhea, that is a late diagnosis, because by the time you have blood, it means that there already is tissue ischemia and death of the tissue. Yes, it is early onset, so you would usually see malrotation in children below the age of 1. Okay, so physical examination, you will find dehydration, abdominal distension from the obstruction, diffuse abdominal tenderness, especially when the ischemia has set in, a shock or septic picture. So usually this would mean that there has been a perforation, and frank bloody stools. And once again, that is a late diagnosis. So there are 3 ways in diagnosing your intestinal malrotation. Firstly, important, we have already mentioned, any infant with bilious emesis will have malrotation, and you will treat it as such until proven otherwise. You can also do imaging with your ultrasound, or you can also get surgical evaluation from your general surgeon. On management of your intestinal malrotation, it can be divided into your medical management as well as surgical management. So a lot of the cases in pediatrics, we would first try with the medical, which is your conservative treatment, before heading to surgical intervention. Right, so under medical management, it looks a bit supportive, fluids, electrolyte balance, and your broad spectrum IV antibiotics if the patient is septic. Under surgical intervention, you can do the LAD procedure and resection of necrotic portion of the small bowel. So in this case, it is quite obvious that there would be necrotic tissue. So that is with your late diagnosis. Your complications occur when it goes untreated. Okay, so complications of an intestinal malrotation that is untreated is necrotic bowel, a short gut syndrome. So short gut syndrome is more a complication of the surgery, because over here you resect the necrotic bowel, and that would lead to a short gut. Next is adhesions. So adhesions would lead to small bowel obstruction. So adhesions is always a complication, or always one of the potential complications of abdominal surgery. And that is it for intestinal malrotation.